everyone. Welcome to Mammography Educators Live with Louise. This is Michaela. I am the host of this show for now, and I am so blessed to be meeting with Louise today to be talking about how to answer patient questions with confidence and with ease and grace. So it looks like we have the Mammo Queen herself. I'm in beautiful downtown San Diego right now, the stomping grounds of mammography educators. So excuse the ambient noise. Hi, Louise. How are you?
Hi, Kayla. How are you?
Hi. I am in the heart of San Diego downtown area right now. So really in the belly of the beast right here, and where Mammography Educators was born. I don't know how close I am to your house right now, but I was like, wow, Louise lives right here.
I
So
wish you could have come over.
I would have loved to come over for some tea, but let's spill some tea today and really get these folks educated. We already have almost 20 amazing people here listening
Great.
and ready to learn from you. So I'm just so grateful to be able to share this space with you today to talk about, how to answer some of these really challenging questions that mammographers often face and radiologic technologists face every single day. So do you want to just kind of give us a little overview of what we're going to be talking about today and why you feel like it is so important to you?
Sure. First of all, I wanted to give a shout out to Michaela. Today, I'm going to cry. Is Michaela's last live with Louise. Michaela's moving on to, I don't want to say better things, but different things in her career. And we're going to miss you so much, Michaela. You've been such a wonderful part of our organization, our little family, and just made this whole live thing so easy for me. And so everybody send kisses to Michaela. This will again be her last time, and I'm sure actually Michaela's sister is going to be start working with us. And we heard they're identical twins, so hard to
We're like the sun and the moon, really. But I'm just grateful that we could stay within the Mammography Educators family, because it has been such an honor to work with you and just such amazing educators in the space. And what a cool, I got to dip my toe into a brand new world. So thank you for showing me what you do here and how you save lives.
Well, we'll miss you terribly, but again, know how much you, especially helping me navigate some of these social media things. Trust me, you guys, I am a rookie, a novice, and Michaela and Jess both have made this so easy for me. So thank you before we get started. So
Thank you. Yes.
you guys, one of the things I get asked over and over again is, what do you say when patients make comments about your job or have questions you're not quite sure how to answer? And I think a lot of times, because I didn't really understand how important it is to give, number one, concise, correct, and compassionate answers. So I would go into these long explanations about dose or about how a man didn't, invent a mammography machine. You know what? Your patients don't want those long answers. They want short, sweet, concise, out of there. Also, too, what it saves us doing, I think, a lot of times their questions or comments can be really demeaning. And the more we perceive it as demeaning, and sometimes they are, things that they say like, what a disgusting job, that hurts us, especially those of us who are really proud of the work we do. So if you know how to respond to that in a concise, correct, and compassionate answer, you don't start getting all involved. You don't want to get defensive. You don't want to over-explain. And again, try to keep it as simple as possible in your responses. So that's kind of what we're going to talk about today. Also,
I love that. So it's earrings day. Yeah. So those are.
these
Yeah.
are
You were in Africa for how long? You were about a week, 2 weeks.
Yeah, for over 2 weeks, almost 2 weeks. And so this is my jewelry made by the Maasai tribe. So
wow,
anyway,
talk about powerful warrior people. Let me
yeah,
tell you, it's no joke.
about that.
What I'm
So,
hearing from you is I'm hearing 3 C's, right?
uh-huh.
Like clear, concise, and compassionate.
Yep.
So when in doubt, 3 C's: clear,
Right.
concise, and compassionate.
You know what? I never thought about it like that. So
Well, you must have, because you said it, but I
Well,
think that's great. And how did you kind of come down to that? Like, how did you get inspired for the responses that you have, and like what led you to come to such a conclusion, right? Because I feel like people can get really worked up when someone says something, you know, emotionally triggering about the line of work that they've chosen to, you know, follow for X amount of years. So how did you come to that conclusion, and how would you share that, you know, responsibility with people?
well, actually, it's really interesting you bring this up because I I would find myself getting way too emotionally involved. I would get defensive when a patient goes, "Is this how you do all day long?" I'd look at her, and I wouldn't say this, but I would think this. Yeah, what do you do that's so important? I say, or I've heard techs say some of the things that I know they don't mean it this way, but they don't. I don't think they stop to think of how it might be perceived. Like, I save lives for a living. Well, you don't have to chastise the patient, okay? Or I've heard techs say, well, my mother died of breast cancer, so I've dedicated my life to something like this. Where that may be the reason you've chosen mammography as an area of specialty. We don't want to kind of put the guilt trip on the patient. So, and actually, I've always been interested in psychology, and a therapist was very helpful to me in my kind of evolution and education of trying to, how can I say, not only educate myself in terms of patient care, but try to expand my horizons as a mammographer and advance my education and experience. And so I had a therapist who was very, very important to me during the time. And so when I started thinking about some of the answers to some of these questions, I thought, you know what? I don't know exactly what to say, so I'm going to go to an expert. So I had a hour-long appointment conversation with a therapist who specializes in communication, particularly patient communications and healthcare. And so she's the one that helped me come up with these snappy answers, I call them.
So what I'm hearing is definitely the things not to say and what not to do in these situations, which is definitely try to transpose like that and reflect that same level of negativity that they're trying to give us like back onto them, because that doesn't really
Right.
honestly even I guess inspire us to take the best photographs. You know what I mean? It could definitely interfere with like our level of professionalism within what our job is to do
Right.
at that time.
Well, don't you think in general, Michaela, I think one of the big life lessons, you're way younger than me, but one of the big life lessons I've learned is don't buy into it. Don't get involved in the negativity. Rise above, rise above, all that stuff. And also understanding that when our patients come in, they all have a high level of anxiety, particularly in this last year and a half. Oh my gosh. Mammography was, mostly, how can I say, not an exam that a lot of women look forward to anyways. But when you pile COVID and masks and weight gain and body image and lack of ability to communicate clearly through our masks, that just compounds it. So understanding and being compassionate to the stress that they're under. And I always try to, when somebody is being not so kind to me, I always think, it has nothing, or I try to remind myself, it probably has nothing to do with me at all. Nothing to do with me. Who knows if they had a fight with their partner before they came in, or they got a traffic ticket, or their mom was diagnosed, with breast cancer a month before, and now they're afraid they're going to have it. We don't know. So try not to buy into their drama, trauma, negativity, and understand it's not about you. One of the things, examples I like to give is, sometimes we'd have a patient who is just like horrible to us and nasty and say nasty things, throughout the whole exam. And then you go and the radiologist says, oh, everything's fine. You can tell the patient, and you go back and you tell the patient. And all of a sudden she turns into this sweet person. And she's like, I'm so sorry if I was mean to you. And it's like, that's all right. But it's true. We all have had situations, again, using compassion. How many times have I maybe snapped at somebody that I didn't really mean to, And, just to think it's the situation, not the person. So I think that's first and foremost.
Absolutely. And your time in psychology has given you kind of this skill set now for being like self-reflexive, and
Mhm.
like recognizing that what other people are trying to hand off to you is often more what they've got going on than how you're performing. And really our, duty, as I say our, like I'm a radiologic technologist, but the role of the radiologic technologist is to do a good job despite all of these challenges and working with challenging patients and working with challenging personalities. And
Yeah.
so, you mentioned that there's a large degree of like negative comments that people get. So I would love to just get into some of these
Okay.
quick, like, responses that you can give in these situations, because I feel like that would be really beneficial for people. So before we get into that, do you feel like outside of, the approaching this with positivity, being self-reflexive, and also recognizing that their problems are not necessarily your problems, do you feel like there's any other really crucial pieces that people need to know when answering difficult questions or dealing with difficult patients?
Well, number one, don't personalize it. Even though I'm a breast cancer survivor, I never tell patients that, never, ever, ever, because then they're going to start asking questions about, well, if I have it, what kind of treatment did you have? And I want the same as you. And I do not share that experience. I do think, though, when, especially as a younger technologist, or maybe a technologist who just has started screening, a lot of times, let's say a 65-year-old patient goes, you can't possibly know what this is like. Well, this is having empathy for your patient and saying, well, actually, I just started having screening mammograms, and I understand, that a lot of times people are anxious about having it. So share that experience. Or if you're younger than you're not having screening mammograms, what I suggest is that you change into a gown, ask a technologist to position and compress you. So then when you are very young and a patient goes, you can't possibly know what this is like, you can say, actually, I'm not old enough to have screening mammograms, but I've had another technologist position and compress me, so I know what it feels like. I know what you're going through. And they're just like, all of a sudden, oh my gosh, she did that just so she would have more awareness. So I think, realizing, kind of the empathy thing is super important.
Absolutely. And putting yourself in someone else's boobs.
Right. I
So
don't say
somebody,
Ella, but that's okay.
of course, sorry. I just thought shoes, boobs. So anyway, somebody did ask, how much longer do I need to get a mammogram for? And that was one of the questions that you listed are probably some of the more common things that people hear. So, I'm 80 years old. When can I stop having mammograms? I'm sure people hear this all the time.
Okay, I always say this is a decision you need to make with your doctor. Okay, and a lot of times women consider having mammograms according to the idea of whether early breast cancer or breast cancer was found, any kind of breast cancer was found, would they have treatment? So a lot of women at 80 years old, they don't want to go through chemotherapy. They don't even want to have an excisional or a lumpectomy. They're just you know what? They'll probably actually, and the truth is, I wouldn't say this to a patient, but most likely they'll die of something else before they would die from the breast cancer. So I always refer it back to their physician. Okay. If they're 75 years old and in really good health, I would encourage them. I say, as long as you're in good health, you can continue to have screening mammograms. Or if you get to a point at which something was diagnosed, you were diagnosed with the breast cancer and you would choose not to treat it, that would be a good time to, not have screening. But I always say that's something that you should talk to your doctor about. Now, interestingly enough, there have been some studies that recommend ending screening mammograms at age 70. Well, I'm 71. I'm not going to quit having mammograms, and if I'm ever diagnosed with the breast cancer again, I definitely am going to treat it. If I was 85, that may not be the case. So again, one of the things too, principles of answering these questions, empower and educate the patient at the same time. Okay. So give her the information she needs, but keep it concise. Say that's something you should talk to your doctor. And, a lot of women make the decision later on in life that they wouldn't treat it. And so they can quit having mammograms then.
Well, you're going to live forever, so we won't ever have to worry about that. Um, and
I
a
don't
lot of people, I'm sure, go ahead. Sorry, I didn't mean to
know.
interrupt
That's
you. So a lot of people probably ask, aren't you afraid of the radiation? Won't the radiation give me cancer? Or if I didn't have cancer before, I sure have it now, like relating to compression. So, there is a lot of talk about, different protocols and why someone would maybe stop doing mammograms at a certain time or radiation and compression. Can you maybe just clear the air on that for some of our technologists? Because I'm sure they get it all the time.
Yeah, the way I answer that question, I say actually a mammography is probably one of the safest x-ray exams that you can have because it's very highly scrutinized and regulated by the government. Now, sometimes they'll say, oh yeah, the government, just don't go there with them. Let them rave about what the government's doing or not doing. But say it's one of the most highly scrutinized and regulated of all x-ray exams. And that's the truth. And you can say, I also, during my training, received a lot, or during my education to become a mammographer, I learned a lot about radiation protection. And I can assure you that there's no harm to me or to you during this exam.
And that's actually something that maybe some people wouldn't consider also is that, if the folks that are getting the mammograms subject to radiation, then, imagine a technologist would be in contact with way more radiation than your average patient if they're only doing it once a year. And yet, we don't see the risk factors, with technologists, and that we don't have a problem with that in
Not,
mammograms.
and that's because, and this is something you wouldn't want to explain to an average patient, that the beam is so tightly collimated, there's no scatter radiation. Also, I mean, you could point this out to a patient, during the exposure, which is very low, because today I stand behind this piece of glass, which protects me from, which has material in it. Don't say lead. They don't understand that. Just say this piece of glass has special material in it that makes it very safe for me to be here.
And
You
someone has just
know,
said, this Stott said, lowest dose too, because they only penetrate tissue and not bone. And that's a really good distinction as
yeah,
well to make, that we
yeah,
don't actually have to go through all the way through the layers of the skin.
yeah, that's a really good point. Yeah, but
Yeah.
I do not get into numbers. No millireds. I usually don't go. I know a lot of people go, oh, your radiation equivalent is flying coast to coast in an airplane. I don't even go there. I just tell them it's very safe and it's highly regulated. That's it.
Point very simply made. And so, speaking of the machine, right? Oh, I bet this machine is made by a man. What's that about?
Well, because, they think that men would be less sensitive to causing discomfort to a patient. But what I explain is, and again, not in an effort to make them feel guilty or say right, I say actually the mammography machine was designed with a lot of different input from both men and women who work as physicists, radiologists, and technologists, so that we could produce the best image possible.
I just think that's amazing too, because this technology has just come so far over the years anyway, and has developed in so many different ways, especially into the digital age. So, when are they going to invent something new? It's like they have, it's always being developed, So how would you approach someone who says something like that?
Yeah. When are they going to do something different? Now, what I say is actually we're doing research on a lot of different methods for finding breast cancer early. But right now, mammography is the best thing that we have.
I hate mammograms. A classic. I hate mammograms and I hate masks. Let's just let's go
Okay.
through all the hate stuff first.
Okay. I hate mammograms. You know what I say? I say, I'm so glad you came anyway. That's it. I'm so glad you came anyway. Not just, oh, everybody hates them or yeah. Just say, you know what? I'm so glad you came anyway. Or thank you for coming anyway. That's all.
I already feel encouraged by you saying that. Like, that
Yeah.
is the coolest thing. I mean, I hate it so much, and yet you still came,
Yes,
and that's wonderful. That could
exactly.
probably change somebody's day. You know what I mean? That's just so positive and empowering. And like you said, empower or educate,
Yeah.
you mentioned, over this last year and a half has been a nightmare for so many people, and making sure people get their regular appointments in, and making sure people are getting their screenings on time. And it's hard enough to get them there. And then when they are there, they have to wear a mask. So how are you communicating with people that are just that hate the mask thing?
Okay, the hates the mask things, say, you know what, I hear you. I have to wear them all day long too. That's it. Just say, I know how frustrating it is. Period. Not like, oh, you should be me. Well, actually, you know what? I'm going to retract. Don't say I have to wear them all day long. Say, you know what? I get it. I so sympathize with you.
Yeah.
Totally understand what you're saying. So if
Yeah.
you say I have to wear them, 12 hours a day, then you're kind of neener. So don't say that. Just say, you know what? I totally understand.
Absolutely. And when it comes to, like, because I know techs are probably going to come up with their own way, just as you just did it. Do you guys ever let someone just ask the question? Do you guys ever let a patient take their mask off? And I know
Mhm.
things are kind of changing right now, and lots of people are already vaccinated. So, what are your thoughts on that?
No, I think in all healthcare facilities, masks are mandatory. And if a patient, well, I would find it very unusual that a medical facility would let a patient come into the facility without a mask. And
Right.
if they come in to do your exam, or they come into the room and they take off their mask and says, I don't want to wear this, or I'm sick of this, say, I'm sorry, Mrs. Smith, that's a requirement of our facility. I need to ask you to put it back on. And if they continue to argue, I would go get a supervisor. Don't sit there and don't join the argument. Okay. Don't be part of the problem, be part of the solution. Say, I understand your reluctance. I know what, I know what you're saying, but it is a requirement here. And then I think it's up to your supervisor, going and getting your supervisor to handle that further, whether, you're going to deny doing the patient or whatever you're going to do. Don't try to take that on. Because you've got patients to do. You've got another patient waiting for you. So let your supervisor or manager handle that patient.
And that's the role of administration. Like, we can just
Yeah.
push it up to the next advisor up, and then technologists can continue doing the important work that they're doing, which is not arguing with people about mask use
Not,
and mask wearing.
I always just say, you know what, why don't I have you talk to my manager about this? And don't even say I have other patients to do. Say, you know what, I'm going to let you talk to Susie about that. And, you come to an agreement about it. You can agree to disagree. Okay. And the
Yeah.
disagreement may be, we're not going to do your mammogram unless you wear a mask.
Right.
I mean, there's no options. When you get on a plane, I was just spent hours and hours on a plane. There's no options. So if a patient comes in the room and takes off her mask, to me, there should be no option either. She's got to wear it for your protection and for hers.
Right. And I'm sure technologists will. I hope this really falls on their ears, and it sinks in, and their own way of disseminating this information and putting it into practice is going to look different for each person. But it really, we all have to be on the same page about safety for each and every person who comes into the office.
Right.
And someone did say it's just hard when a patient says that they can't wear it based on a medical condition. And so I know that a lot of people are starting to use these kind of excuses and ways of getting around it. So, we could talk about that all day, but, according to you, just really encourage, or just say we can't do it unless you do put it
Or just say, not I, say the policy here. And then again, you can hand that off to somebody else. And I know there's situations when, people say they can't wear a mask, but that should have been determined before they go in the room with you for a mammogram.
Right. Absolutely. And, speaking of being in a medical office, like, there are radiologic technologists are not necessarily nurses, right? They
Oh,
are something a little bit different. Do people ask that? Do people ask if radiologic technologists are nurses?
a lot of times they'll say, oh, are you a nurse? Or why didn't you become a nurse? Or yeah, are you the nurse? I love it when they say that. Are you the nurse? This is the short and sweet. No, actually, I'm a technologist, and it's very different training. That's it. You don't have to quantify it. Just say, I'm a radiologic technologist, and that's very different training from nursing. Just that.
Perfect. And nurses and radiologic technologists are definitely not trained to play with breasts all day, right? And so why are people feeling like that's what radiologic technologists want to do all day, is play with breasts?
Well, it's, the question, most commonly is this all you do all day long? And I say there's lots of different things that are required of me during the course of my day, but I love working with patients, and that's what I get to do most of the time. So that's just it.
Okay. Thank you
But
for that. And I mean, considering like frequency, I know we kind of touched about frequency and like talking to your doctor about how often age doesn't change too much unless this course of treatment changes that a patient is choosing. However, if someone is saying my doctor only told me I needed to come X amount of times, or I answered all these questions last year, why do I have to come again? How do you kind of meet these questions if they're saying that their doctors are telling them something different than what is, recommended?
okay, this is a really good point. The first one, and which is different from what age they should quit screening. They say, my doctor says I only have to have a mammogram every 2 years. What I say is actually studies, again, not getting into hard science, but say studies have shown that annual mammography, having a mammogram every single year, is so much more beneficial for women than having them every other year. And it's like, well, my doctor said, well, you can explain to them, again, without getting into too much science, the American College of Radiology, or our radiologists, who are the doctors who specialize in reading mammograms, strongly recommend having them done every year. And the one about the history sheet, oh my God, it's like, I filled this out last year, nothing has changed. Say, well, it's my responsibility to make sure I go over each and every question with you to make sure nothing's changed. They don't like doing those history sheets, but it's part of our responsibility. And if you explain to them that the really important, their individual patient history is something that the radiologist is looking at, or should be looking at, as part of their overall mammogram.
And you mentioned, just responsibilities, duties, part of this job description and part of the career of being a radiologic technologist is to usher people in through this, take amazing images, and help people feel comfortable wherever they are at in their life. And so I think you've given some amazing, quippy answers that anyone could really take home with them and learn from. But if someone's on the spot, and they don't have you in their ear coaching them on what to say, how can techs develop their own answers, and like what would guidelines kind of be? I know you touched on the 3 C's: compassionate, clear, and concise. What was it? Educate, and you said something else that was really wonderful, like inform, educate, and
Educate, encourage.
Encourage. That's
Yeah.
right.
Yeah.
So would these be kind of guidelines? People can ask themselves, technologists can ask themselves, is this, concise? Is this clear what I'm about to say? How would you run through it in your own mind so that what comes out follows these kinds of, specifications?
What I do is I have developed what I call scripts, and scripts are you're already using SCRIPTS. So when the patient walks in the room, you go, "Hi, my name's Louise. I'm the technologist going to be working with you today to take the best pictures possible." Whatever your little script is, you say it every single day. So you have to practice these snappy answers too. So here's the cool thing. Right on our resource page, I printed this out. Go on our resource page at mammography-educators.com, and it's got this really cool, it's called Tips for Scripts. And it's got all these questions and more that we talked about, and other tips too. So another really good way to do it is have somebody go in the room and listen to you talk to the patient. I'll give you an example. One time I was working with this really cute tech, and she was really cute sense of humor, and we were having a good time working together. She walked the patient down the hallway, and she was super friendly, and she said to the patient, well, as we were walking in the door, welcome to the torture chamber. And the patient put like a mule, put her heels in the ground, and she's like, "Arr!" She's like, torture chamber. So let's say that woman has had 5 good mammograms. I know. And I know she meant well. She was trying to use humor to make light of the situation, right? But you have to be careful, because this person who, let's say she's had 10 good mammograms, but her girlfriend told her 2 nights ago at happy hour that, when she had her mammogram, the friend had her mammogram, she felt like she was tortured. So it's like, whatever power of suggestion you put in the patient's mind may come to fruition. So again, have somebody follow you in and listen to your script and how you say it. Short, concise, caring. Okay. And you'd be surprised. I always think, I'm doing a good job, but when I've had people give me feedback, it's like, oh, I didn't realize I was saying that. And you don't, because you kind of push the auto button. And another good thing in terms of communication, when you're talking to your patient, talk to her in terminology she understands. This is about dose. Don't say millirads and, whatever, or PSIs for compression, or even sometimes they don't even understand the word density. I'll say thickness in your breast. So use terminology they understand when you're giving them explanations. I don't say CCs and MLOs. I say top to bottom and side views. So it's just, keeping those things in mind. And again, these little tips are for free on our website.
Yes, thank you so much for pointing to the resources page, because among so many things, this is one of those really valuable resources. So if you're just catching the end of this conversation and you really want to, just get right into it and look at scripts, practice these responses. All these responses are in our resources page, and it's called Tips for Scripts. And practicing these and having somebody else kind of walk with you, we can't always see the chewing gum on the back of our head. You know what I mean? So it's like we sometimes need a friend to be able to point these things out that we can't see about ourselves. So it's really important.
For skirt, right?
Yes, absolutely. So somebody did say, it looks like we have some really nice comments. I love my job. I've been doing mammos for a year, learning every day. Someone said, I always say I get to do your exam today. And so that really kind of communicates a sense of gratitude between a radiologic technologist and a patient. And that's very sweet.
Or I feel lucky to be able to perform your mammogram today.
Yeah,
or totally. I'm grateful to be able to perform your mammogram. Because you know what I say to baseline patients? I always get so excited. It's like I want to throw them a party. I always say, you know what? I'm so glad I get to do your first mammogram, because I really want to make it a good experience for you so you come back.
Absolutely. And it's not the teacher, right? It's not the subject, it's the teacher. You know what I mean? It's not the exam, it's the person who's doing it for you,
Right.
And that makes all the difference in the world. So, I guess part of the duty as a radiologic technologist is to be that light, is to be that person who leaves a good impression and makes a person feel warm and welcome to come back and to do something that might be uncomfortable, but for the long run could potentially save their life. So getting those mammograms every single year, and also creating a loving environment for people that they look for you. They want you to do their exam, and that's really special service to be able to do for somebody. So what an amazing job it is to have, to be a radiologic technologist.
It's super powerful to be able to do mammography. I think the biggest you can have is when somebody says, can I ask for you next year? And that's that. Or I was looking, or you weren't here last time I came in, I missed you, or whatever. And just to realize how powerful that is. They've actually done studies that show the biggest predictor of whether a woman will have a subsequent mammogram is the experience she just had with you. So that's powerful stuff. That you can be the agent of change That's so powerful. So you guys remember how important you are and how important your interactions with your patients are. And you know that, but hopefully some of these little tips will help you kind of get over some of these bumps.
Absolutely. And with that, I think that's just such an amazing place to kind of just cut the end and
Okay.
seal it in such a good way. You know, do you feel like there's anything else that we didn't get to cover or that you feel like someone needs to know other than just go check out our resources page, tips for scripts for these exact tips and scripts?
Mhm.
But I feel like, wow, what an awesome conversation and what an empowering way to kind of just leave off that it's, you know, through the language that we get to express the feeling of that sense of what I'm doing is really important. And no matter what, I'm going to stay in a positive, centered, and grounded space while we usher people through this process. You know, the
Right.
words and the
Absolutely.
language are just how we convey a very inside feeling.
Yeah, absolutely, Michaela.
Yep. Okay. Well, thank you so much.
Okay,
I,
thank
I, I just love you so much, and thank you so much for having these amazing
you.
lives with me. And we'll be talking soon. Thank you so much. And for everyone who watched, please go ahead and visit us on our website, mammography educators.com/resources, and continue to follow everything that we're putting out because we really are doing our very best to be a light for mammography and to elevate the profession. So thank you so much, Louise, for all the work that you've been doing, and for the entire team here at Mammography Educators. Thank you so much for joining us.
Thanks, Michaela. We'll miss you.
I'm going to miss you guys too. Take care. Lots of hearts.
Okay,
Have a
bye.
wonderful day.